and professionally speaking, many people are quite afraid of meconium, and yet many people don't really understand what meconium is. It is a thick, viscous, gooey mass which has been accumulating in the baby's intestines since the baby is about 10 weeks of gestation. It is mostly made up of the baby's lanugo, the hair and the skin cells that the baby loses and exchanges for new ones in utero, together with gastrointestinal secretions, bile acids, mucus, pancreatic fluid, blood, and swallowed vernix. Most times when there is meconium at birth, it doesn't produce any problems at all. Even if the babies are born with meconium, usually they do not aspirate or inhale it into their lungs. But in the case of aspiration, the lighter the color of the meconium and the less thick, the easier it will be for the baby to be able to absorb it into her lungs or to expel it, and the breathing pattern of the baby will become stabilized. We should always keep an eye on the baby's breathing patterns. I'm going to share with you a very beautiful birth. It's just so moving. And then when we get into the meconium, you will be able to see some different techniques that were applied to be able to solve this situation and bring it to a very good outcome. Having the right equipment, knowing how to use it, and keeping a really good focus can make all the difference in the world.